and the Federal Ministry of Health and other partners.
Now, this gathering is a gathering of countries in sub-regions to share experiences. There are some countries that are fully established institutes. There are some in the process of establishing, not fully established. There are some who have not started at all. The idea of this gathering is to share knowledge amongst those who have established, those who are in the process of establishing, and those who have not. Shared knowledge, the processing they went about it, the challenges we face, so that those of them who have not can go back and develop such capabilities. And at the same time, share lessons from people, different experiences, so that to enrich each country of experience from other countries, so that it can effectively be able to tackle health security in the West African sub-region.
When you have a good plan, you should be able to envisage that it's most likely going to happen, and you work towards it. So we have called this meeting for us to interact with other countries, or other public health institutions in sub-African region, for us to find a way. Because every country has its own peculiarity. They will be able to learn from what we are doing here that they are not doing in their own country, and also learn from how they are tackling their own issues. But the bottom line is that any disease somewhere is a disease for every part of this world. So we need to work together. The underlying one, collaboration and sharing of knowledge, is what we are going for. Thank you.
One of our key agenda will be to support each and every member state on the continent to establish national public health institutes. And for those who already have, support them to strengthen those national public health institutes. So in terms of advantages, many a times when there's outbreak, it takes time for us to detect. It also takes time to respond. In fact, it takes much longer time to rebuild back better, stronger, and bolder. But with MPHI, and from the experience from those countries who have MPHI, we discovered that decision delivery time tends to be faster. In terms of utilization of resources, tend to be better. And in terms of rebuilding back, using that memory, that experience from those outbreaks, it tends to be better when you have MPHI. So this is actually part of the reasons why it's always good to have an MPHI. Even when you look at in terms of management of the different partners, because whenever there is an outbreak, you see a lot of partners pour in, So in terms of effectively and efficiently managing those partners, when you have MPHIs in place, it's a lot better than when you don't have those MPHIs.